Another day, another walkout. Scenes like this have become all too familiar in the UK as health workers across the country clamour for change.
Doctors are tired, they're frustrated, but ultimately we're terrified at the state of our healthcare service. Doctors, we're patients, and our families are patients. And we've seen the quality of care in our healthcare system decline over the years. We used to have real standards in this country. Patients used to be seen within A&E within 4 hours, and now you're lucky to be seen within 12.
Since the strikes began in 2022, the knock-on effects have been severe, with more than 1.5 million appointments and operations cancelled and waiting times extended. The National Health Service is one of the main priorities for British people as they prepare to vote next week. But the NHS is in crisis, and this strike exposes just one of the many problems the UK's next government is expected to fix. The British Medical Association, the Doctors' Union, says their pay has dropped by a quarter over the last 15 years and has called for a 35% pay rise. And in the lead up to the elections, politicians have been at loggerheads on what plans they have to bolster the ailing health service. All political parties have plans to improve the NHS in the race for number 10, a sentiment which has been echoed by former UK opposition leader.
This is a message to whoever moves into the health ministry, whatever department takes it over next week. They've got to settle this straight away, and that will mean paying a lot more money and a commitment to guaranteeing those salary levels for the future.
Although all parties have agreed to talks over the dispute, Labour's leader Sir Keir Starmer has not agreed to the increase, saying, to be absolutely blunt, we're not going to 35%. With hundreds more doctors thinking of moving elsewhere to practice, the state of the NHS could make a difference at the polls. Lape Larinoye, TRT World, London.